So, welcome back to the second part of the critical appraisal lecture. So, this is where we enter critical appraisal properly. Okay, the first part is just on the essential components of original research article. Okay, so why should we do critical appraisal? As I mentioned previously, that all scientific articles that's published online are imperfect because we are human, we are prone to errors. Okay, so critical appraisal is performed by the readers to assess the reliability of scientific findings. Okay, they are similar but not the same as comprehensive reporting by the authors. Okay, comprehensive reporting is what the authors do to ensure that all the essential components that are needed or required for a certain type of publications are all written down in that manuscript. But critical appraisal is being performed by the readers to assess whether all the essential components or whether there are bias uh, or the bias avoided in a particular publications. There is no specific guideline for critical appraisal, but there are two components that should be assessed, which is the validity of the study and bias. Okay, you can start by asking a series of questions. Okay, so first thing, what is validity? The first question you should ask is, can the study be generalized on the populations? Okay, from this country to another country, or from animal to humans. Okay, and in terms of validity, the reader should ask whether the findings of experiments are replicable and whether the results are subject to the biases. So first thing, what is biases? Okay, biases are systematic variation from true state of nature. Okay, it is in not equal to imperfections. Okay, imperfections result from random errors. For example, if I were to measure your body weight and ask you to step on a weight machine for 3 times, and the values given are 60.1 kgs, 59.9 kg, and 59.8 kgs. Okay, so these imperfections do not have a trend. Okay, sometimes a bit higher, sometimes a bit lower. These are imperfections. However, if I ask you to step on a weighing scale, you know that you are 60 kg, but then the weighing scale constantly shows that you are 61 kg all across 3 times of measurements, and this is bias because it's an error. It occurs systematically. Okay, you're always 1 kg more. So what are the common biases that one would expect in scientific articles? Okay, so the first example of bias is selection bias, which is a systemic difference in baseline characteristic between control and treatment. Okay, some of the factors that would contribute to selection bias, including the age, weight, ethnicity, strength of the animal, and sex. Okay, for example, if you were to conduct a randomized control trial, okay, you have a treatment group, you have a placebo group, and your placebo group are different from the treatment group in terms of age, where they are significantly older, okay, or they are significantly more unhealthier than the treatment group. One will expect that they will perform poorly in this clinical trial. So this is selection bias. The characteristic of placebo and treatment are not distributed equally between these two groups. Or you have 80% of the subject in the treatment arm are male, and then only 40% of subject in the placebo arm are male. Okay, so this unequal balance of sex could contribute to a different performance in the drug as evaluated in a placebo control trial as well. Okay, and this should be paid attention to. Secondly, we have performance bias, which are systematic differences in care provided between groups. This is usually arise due to the caregivers are not being blinded in the study. Okay, for example, again in a placebo control trial, a doctor is taking care of patients, are aware of the assignments of the patients, meaning that he or she knew that which subject are in the placebo control and which subject are in the drug treatment trial. So there is a chance that the doctors would treat the placebo group and the treatment group differently, and the level of care given to the treatment group and to the placebo group could contribute to the different results in a trial. Okay, the doctor might want to treat the treatment group better compared to the placebo group because they know that they are not getting better because of treatment. Thirdly, we have detection bias, which are systematic differences in assessing outcome between the group. Okay, and this is because the assessors are not blinded. Example, let's say the doctors are measuring the blood pressure of a hypotensive drug trial treatment. Okay, so if the assessor or the person measuring the blood pressure is aware of the assignment of the subject, when the subject in the drug treatment have elevated high blood pressure, so he might ask the subject to be measured again, to calm down, to measure again, while he will care less about the placebo subject high is high. Once measured, you are fine. Okay, so this level of detection bias is actually quite frequently committed by the lab, especially during the animal studies where we most often than not we are aware of the assignment of the group. Okay, so let's say I'm assessing the histological slides of rats given different treatment, and I know the what kind of treatment the rats receive. Sometimes I will score the histological slide better in the rats given the treatment rather than uh, rats given the placebo. Okay, and also we have attrition biases, systematic difference in withdrawal rate between the two groups. Okay, so subject in a clinical trial will leave the group when they are sick or they are very sick because of the treatment. Okay, so sometimes the doctors replace subject with attritions with newer subject. Okay, so in a clinical trial, let's say the placebo arm have 10% and the placebo arm have 10%. The placebo arm, the 10% placebo arm continue throughout the study period, no one withdraw. But those in the treatment arm, 5 of them withdraw from the study because of the side effect of the drug, and the doctors replace them with another 5 new subjects. Okay, and in the end, the doctors noted a better result in the treatment arm compared to placebo. Should he or she also consider that 5 of the subject in the treatment arm actually withdraw because of side effect? Okay, this is a question for you to ponder. Okay, and sometimes in the animal studies, we replace subject who die because of treatment with a new batch of animals. Okay, and this would contribute to attrition bias as well if we don't report the animal number of animal that is being replaced in the treatment group. And we also have reporting biases, whereby important details are intentionally hidden from readers. Okay, for example, unfavorable results are not being published. Okay, and this is very prevalent in the scientific community as well, we might have conducted a lot of tests for study, but then we delete the tests which are not significant or no significant improvement from the final reporting. Okay, if the authors are not careful, maybe he will report the measurements of the unreported parameters in the methods, but he or she leave out the results in the result sections, and that's where you can detect reporting biases. Okay. Or for example, this study conduct a full back count for the subject, but then the authors only listed the RBC and hematocrit value, but he delete all the white blood cells parameters. You might wonder why when you are reading the results. Okay, and this may be due to reporting biases, because maybe the white blood cells parameters are not very good in the study. And then we have random errors. Okay, and random errors are different from biases. Okay, because they are not intentionally committed. The extent of random errors actually determine the significance as all, because you know that your p-value actually measures two the overlapping or two distribution curve of less than 5%. Okay, the distribution curve actually represent the variations, and part of it is because of random errors. It is influenced by sample size. Sometimes it's easier for you to get significance when you have larger sample size. And random errors can be assessed using the statistical tests you use and reporting a p-value and marginal errors. Okay, marginal errors include 95% confidence interval, standard error mean, and also standard deviations. And you can judge from the marginal errors how reliable is the estimate or the parameters being measured. So these are some exercises for you. Please comment on the following scenario. Flu bug count was performed for the subject, but the papers only report the result for red blood cell level. This is the same as the example that I've given you just now. What kind of bias is this? Okay, this could be a form of reporting bias. 4 rats receiving treatment A was sick and euthanized, and they are replaced with healthy rats. No rats in the control group were replaced, and the authors did not disclose these attritions in the reporting. And this is a form of reporting biases. The treatment group consists of 10 women and 10 men aged 50 years old, and the control group consists of 20 women of similar age. There's no men at all. Okay. So what kind of bias is this? Okay, this could be a form of selection bias, because the characteristic of the treatment and placebo are different in terms of sex. There are 3 groups in the study. The mean difference for each parameters were compared using repeated t-tests. I'm pretty sure that you have undergone your community health module, and you know the appropriate test to use for each kind of scenario. Okay, each kind of study. When you have 3 groups and want to compare the mean, the best test to use is one-way ANOVA. So if you use 3 times t-test, what happens? The type 1 error will be inflated. Okay, so it might be a bit difficult for you to imagine this, but this is my example. You have a 30 kg rice bag. If you measure it at once using a weight scale with a margin error of plus 1 kg. So 30 kg rice bag being measured once for using a scale with margin of 1 kg plus 1 kg error, you can get 30.1 kg reading. Okay, but if you divided the 30 kg rice bag into 3 different rice bags, each of them 10 kg, and you measure it 3 times using a weighing scale, the final value that you are going to get is actually 30.3 kg. So if you use repeated t-tests to achieve a statistical test, the margin of error achieved with repeated statistical tests would be larger compared to just using one test. Another example, there was significant inverse relationship between testosterone and bone marrow density in the subject. Is there any errors that you can detect? No, there's no error. The cage of rats were labeled according to the treatment received, and it's visible to the caregiver of rats, and it's also visible to the lab tech who measures the outcome. Okay, this would constitute performance biases or detection biases because the person who care for the animals are aware of the assignments of the rats, and also the person who would conduct the test for the rats is also aware of the assignment of rats, and they might care better for the rats who receive the treatment. And lastly, the treatment group visited the care center every Monday, and the placebo group visited the clinic every Tuesday. And the doctors are aware of this assignment, okay? And this would constitute performance and detection biases as well, because doctors would know that the treatment group should be care better. The treatment group who visited the clinics every Monday should be care better, and the placebo group who visit the clinic every Tuesday, no, they could not care less. At baseline, the weight of rats in treatment group was significantly higher compared to the control group. Okay, for drug that would sequestered by the adipose tissue, this would cause uh, difference in the results, and this is actually a case of selection bias. The performance drug A was compared to drug B, which is not a standard drug used in the clinical setting. This is not a fair comparison. This is part of a detection bias as well, because drug A who is being tested are not compared with the standard drug, which is the best in the clinical practice. So despite that, I have said there's no specific checklist for clinical appraisal, but these are a sample list that I put forward to you to guide you in your critical appraisal SGD. Okay, you can have a look at the journal to see whether it's a reputable journal, is being peer reviewed, whether it's being indexed, and what's impact factor. Okay. You can look at authors and their affiliations, whether they are from reputable university, and the authors, whether the authors have extensive work on the field that's being conducted. You can check their publication background using PubMed or Scopus. You can look at the funding of the manuscript of the study, whether it is from private or public. Usually there's no issues with public fundings. But when it comes to private funding, then you should be careful. If the clinical trials are being funded by private companies, you might want to check whether the authors receive consultation fees or royalties from the companies or not, or maybe the authors is a shareholders of the company, and this will constitute a conflict of interest. Okay, because if he or she is a shareholder, there is a tendency for him or her to report a positive result. So look at the abstract, whether it's structured or unstructured, depend on the format of the journals. Okay, but it's very important for you to have a look whether the abstract consists of all essential components. Okay, a quick assessment of objectives, that subjects, study designs, and treatment results. Okay, this should be all included in the abstract. In the introductions, where the authors have introduced the background of the study, problem investigated, what the previous research being conducted, what the research gap, and also whether the objectives are being explained in the introductions. Methodology, whether the validity are ensured, and also biases are avoided in the methodology, whether confounding variables are being adjusted, whether appropriate statistical tests are being used to achieve the objective, and whether the tests used are appropriate to avoid inflating Taiwan errors. For example, for a test that can be solved using one-way ANOVA, you're using multiple t-tests, then you're inflating, the authors are inflating the Taiwan errors. In the result, you can see whether the figures or tables are reflecting the result in the text, whether they are matching data. In this case, you can cross-check with methods, and whether the p-value and the marginal errors are being indicated in the results. In the discussions, you can compare the result with previous finding, whether the authors have compared the result with previous finding, whether there's a balance between the comparison of positive and negative findings, okay? Whether the explanations, observations, whether explanation for the observations are being provided, and did the author explain the limitation of the current study? It is very important because no study is perfect. Conclusion, whether it is a fair summary of results, and whether it is over generalizations, whether suggestions are being provided by the audience, by the authors to the audience. Okay, and references are all the standard references and reason important are pertinent. Okay, this is the reference for my slides, and I wish you a good sessions in critical appraisal. If there's any inquiry, please kindly email to me, or you can ask in the UCAM folio. Thank you.